Hello class, my name is Abdul and today I'll be presenting to you a comparison between United States healthcare and UK. We know both countries are well-developed countries in the world today, so this is a good comparison I think. We'll be looking at the healthcare funding, how both countries are funded, both countries' healthcare system are funded, healthcare spending, how much every country spends on healthcare, uh, quality of healthcare on both countries, and availability of care. Starting with healthcare funding in the United States. Healthcare funding in the United States is paid by government programs such as Medicare, Medicaid, um, private health insurance plans, usually through employers, also persons' own funds, out-of-pocket fees. According to the United States Census of Bureau, roughly about 55% of Americans obtain insurance through employer, while about 10% purchases it directly. Maybe they are self-employed or different occasion. 31% of Americans were enrolled in public health insurance program in 2010. Approximately 16 of Americans are uninsured as of this was done in 2010. While in the United Kingdom, the healthcare is mainly provided by England's Public Health Service, National Health Service. Uh, it provides healthcare to all citizens and permanent residents in the United Kingdom that is free at point of use, uh, paid from a general taxation. So anybody who is a resident of United Kingdom, who is a citizen of United Kingdom, he has the right to get free healthcare. He gets seen by a doctor. He gets whatever his health needs are. They get taken care of, and he does not pay anything out of his pocket. All of this is funded by the government. How the government funds this by taxation. As the United States, we all pay taxes every year. So the healthcare the tax is a little bit high in United Kingdom, but that's how uh, they fund the healthcare system. Those people who don't pay tax, they still covered with the healthcare, even if they never pay tax in their life or they don't have a job or whatever reason, they are still covered. That's an advantage of the system is everybody, whoever is a citizen of the country of UK, whoever lives there is covered by that system. Now, healthcare spending. Healthcare spending in the United States is greater than any other country in the world. According to official US estimates, spending on healthcare reached about 2.9 trillion in 2014, amounting to more than 17% of US economy and more than 9,110 per person between 2013 and 2014 alone. Spending on healthcare increased about 5.3%. That's United States healthcare. That's cost 2.9 trillion in 2014. Now it should be more than that. Now, when looking at UK, United Kingdom, the total healthcare expenditure, United Kingdom, we have to remember it's paid by the government. Nobody pays no health insurance. It's all paid by the government. And the total healthcare expenditure in UK from both public and private sectors was about $193 billion in 2013, increased only 2.7% between 2012 and 2013. Total spending per person on healthcare was about 3,000 in 2013. Total healthcare expenditure in UK accounted for 8.8% gross domestic income or GDP in 2013. So the United Kingdom have a free healthcare and is spending less than United States. Now we come to quality of care and average life expectancy in the United States. The average life expectancy in the United States is about 78.4 years, ranking fifth, no, 50th among 221 nations of 17 high income countries studied by the National Institute of Health in 2010. The U.S. had highest prevalence of infant mortality, heart, lung disease, sexually transmitted infections, and disability. Um, Now, when we look in UK, life expectancy in UK is about 80.75 years, which is more than United States. Uh, in a comparison with six other wealthy countries, Australia, Canada, Germany, Netherlands, New Zealand, and UK, uh, NHS was rated the best healthcare system in the term of efficiency, effective care, and cost-related problems. Now, availability of care in UK. Getting care when you need it is universally important. Speed care in emergency rooms is essential. The UK healthcare system target is to have patient wait time of 4 hours or less for 95% of its patients. Currently, they have achieved this wait time of approximately 85% of emergency patient care by comparing 95% of visitors to ER are seen within 3 hours of arrival. The average wait time for emergency accident care in UK emergency rooms is about 58 minutes. American emergency rooms wait times may not be bad, but when it comes to seeing a primary care physician, you may be waiting longer than you would like. A 2014 Merritt Hawkins study surveying average wait times for new patient appointment found that someone looking to see a primary care physician would wait anywhere from 5 to 66 days, and the average was about 19.5 days. Thank you very much for listening. I think we have seen both countries, what is the best and what differences are there. United States healthcare more than cost us more than UK. UK costs less. Government pays less to the government pays for the healthcare, and all of it is covered, and the patient don't pay no fee. It's free for them, and they spend less than United States, who only pays part of the healthcare for those who cannot afford Medicare, using Medicare and Medicaid elderly, and United States spends way more than United Kingdom could have. United Kingdom spends. I think we can see both types. We can compare both healthcare systems, and we have a better idea of how both systems work. Thank you very much.